Lots of misdiagnoses are going on in the country, and once you have misdiagnosis, you have mistreatment. And when you have mistreatment, healthcare becomes hazard care. It's not healthcare again. What we're set out to do today, inaugurating this technical committee on laboratory regulation and inspection, with the sole aim of eliminating, not fighting quackery alone, but eliminating quackery in our entire health sector. Cited that the Global Fund thought about this years ago, and the DNO project is about mapping the entire lab within the country. So the project will be starting, I think they have the RFP out, and hopefully, based on your timetable, I was looking at it, it will start before the end of this year. Am I correct? So the DNO will map every single laboratory in the country. So at least we're starting, this technical working group is starting at a very good level. You're not going to be shooting at dark, you're not throwing dart in the dark. So you will have the database of all the labs in the country. And as they do it, each lab will be given a facility identification number. And as part of it, I've also mandated the registrar with the Medical Laboratories Council via the registrar to make sure that their database is well developed. So we can now sync all these labs on your database, that we'll have a situation that anybody can go and look at the Medical Laboratories Council website and identify labs that are registered in the country. And as you have this database, if you're going to have thousands of labs that you don't have oversight, that you don't even have a bird's eye view of now. And part of your work as you put these policies and regulatory framework together, you have to quickly look at how you will have extension of your regulators that will be able to go to this lab. And currently what exists today, what the medical laboratory scientist is doing, and we should not be shy to make public our inadequacies. But then, the good thing is we've identified those inadequacies, and we need to solve them, and we'll solve them permanently into the future. Medical Laboratory Science Council today would accredit lab, but they don't have a process to go and re-accredit these labs. You don't just give somebody, you've given me a license to do something today, oh, you should follow this certain criteria. Yes, I did it, I followed when you gave me the license, and you let me lose forever. You have to police. Every human being, we have organization, anybody, we have propensity to be bad actors. It is the mechanism of government, the force of government that makes everyone conform. And that's what we're doing here. We will now, as part of this, there will be process put in place. Any lab that has been accredited will now be re-accredited. With part of what you're going to be doing is that you set up the time. Is it 2 years or 3 years for the re-accreditation of these labs, and then we will use the act, the existing legislative act, that the force of the law that you have. If a lab is not accredited, that lab gets shut down. And then you've considered the member of the committee carefully. This is full disclosure. You've included 3 core members of the 4 rims of the government, the press, and this committee. You will help us disseminate and sensitize the public, and help us as we go along. Labs that are de-accredited must be put on your website, and your legal. You put your director of legal on this part of the thing. They should also be prosecuted. If you find them functioning, we have to take them to court. You have to get the police. We have a one government now. This government is functioning together. There's no division anywhere, and we're collaborating very well. If you want to go do your inspection, you want the police to follow you, just write to the Inspector General of Police. It would quickly provide the men and women in uniform that you need to go. We have to enforce, and we have to show that this is a government. We listen, but we care. And part of the way government cares for the people is to enforce all the laws of the land. And that's what we're doing, and we're doing it everywhere. And that's why we said our first pillar is governance. And you can see, even without spending a lot of money yet, just improving governance in the health sector, a lot of things have changed. Lots of things have changed. We're holding ourselves more accountable. Now, we're using this Medical Laboratory Science Council as a model to regulating our healthcare in the country. It's sad, but I'm not ashamed to say it. We're not regulating. We don't have a process to regulate our healthcare facilities in the country. Honestly, our hospitals are not being regulated. Diagnosis centers are not being regulated. Doctors, surgical centers are not being regulated. And we all seems that, we have this idea to regulate. But you look at the Medical and Dental Council, they only regulate the health professionals. We have the Nursing Council. They regulate the nursing professionals. The same thing with the Pharmaceutical Council. But our facilities are not regulated. They're not. And you won't know until I got to know this, and I'll give you the way where how I got to know this. Our kids were being abused. Some bad element in the country, they were going to harvest these kids' kidneys, paying them pittance, selling, deceiving them, harvesting their kidney and selling it. There was a cartel that built up around Abuja and some other part of the country. A very smart journalist did a big expo. So I called her, we talked and said, okay, what do we do? I called everybody, the IG, the Medical and Dental Council. Today, as I talk to you today, the hospital that was exposed in that act, nothing is being done to the hospital. The hospital is still open today. We don't have any mechanism in the country to shut down that hospital today. We do not. No, we do not have, as I'm telling you, we do not have any mechanism by law to shut down that hospital. We have mechanism to punish the doctors, which we've done, but the facility, we do not have any mechanism to punish that facility. That's the fact of the matter today. But then we're moving quickly to setting up a national health facility regulatory agency that we're going to move. We'll take to the to FEC, and then President will give us right to go executive bill to the legislature. At least we know where this huge gap is, and we're working to fill that. But the good thing, the beautiful thing of all this thing I've talked of, all this gap that I've identified, in the on the lab side, we have part of the heart of the Medical Laboratory Science Council of Nigeria to regulate facilities. So we will now use that, at least we will start, and that's why we have to do this very well. We have to get it right to regulate, to start regulating. And this will be a model for a bigger regulation of the other facility in the healthcare sector. And that regulator, and I can promise you today, that the regulator of the lab will stay within the domain of the Medical Laboratory Council. So you need to do that very well. You need to show the country that you can do that. You need to show our people that you care, you can help regulate so that the lab services in the country, so that our citizens will be assured that whenever they go to any labs, whenever any result is given about their health in any hospital, those results can be trusted, they are validated results, and they can trust, and care decision, medical care, healthcare decision can be made that will be sound on those results. You hold a pivotal role here, and please, don't let the nation down. It's a challenge that you need to take with all honor, with pride, and ensure that we start having all our labs in the country, we can trust their results with all confidence. So I commend everybody that will serve on this committee. You've been chosen not based on patronage, You've been chosen because of the experience you're bringing to forward, because of your deep experience in governance, in regulatory process, and the practical aspect of our lab services. So I congratulate you for being members of this committee. And I'll be a bit, as I said, to read out the terms of reference again, is not, I don't want to be duplicitous or repetitious here, but this is extremely important. Number one, to develop and establish a sustainable and functional model for national laboratory inspection. National laboratory inspection. Every single lab in the country must be inspected at the point of accreditation and must be inspected at every point of re-accreditation. Number two, to adopt a regulatory model that will improve the quality management system of private and public medical laboratories in the country. Your quality management system will include use of data. Part of your process. Today, lab information management system is an easy technology. It's available everywhere. It's not rocket science. This technology has been here for almost 10 years. What does lab information management does? It integrates with the EMR, it generates reports, automated printing of this report. No lab. Part of your regulatory work, every lab must have their lab information management system. Every lab that is being generated must be automatically printed. Any lab should not be writing results. And I'll tell you, I have a personal experience. My wife, but we have some people, some domestic air. My wife said, "Oh, I have to do blood tests." I said, "Why are you doing blood tests?" I said, "I just want to do it." They went to one lab. He wrote this positive result. I said, "No, as a doctor, I am not going to accept a written positive result. It's not fair on that person." I said, "You need to go back to where the result was generated." They generated, it went again, the result was negative. And this is what we see every single day happening to thousands or hundreds of thousands of our citizens. That's lots of misdiagnoses are going on in the country. And once you have misdiagnosis, you have mistreatment. And when you have mistreatment, healthcare becomes hazard care. It's not healthcare again.